Hello everyone, my name is Savannah Smith and I've chosen topic question 1. I'm going to be talking about the National Practitioner Data Bank. The National Practitioner Data Bank, or NPDB, is an information clearinghouse that has the primary goal of improving the quality of healthcare, protecting the public, and decreasing healthcare fraud as well as abuse in the United States by attempting to prevent healthcare providers and other healthcare entities from moving to different states without disclosing previous performance that is incompetent or damaging. The NPDB was created by the federal law, which requires the reporting of medical malpractice payments as well as adverse actions which are related to healthcare practitioners, providers, and suppliers. The information collected includes medical malpractice payments, federal and state licensure and certification actions, adverse clinical privileges actions, adverse professional society membership actions, negative actions or findings by private accreditation organizations and peer review organizations, healthcare related criminal convictions and civil judgments, and exclusions from participation in a federal or state healthcare program. This information is again reported to protect the public and improve the quality of healthcare. The cons of making this information available to the public is that it can have serious consequences for the physician. The physician may have decreased opportunities for employment, and their ability to obtain medical liability insurance may be hindered as well. The report may or may not adequately reflect the physician's competence, and this may cause it to be very difficult for the provider to have their career recovered. The pros of making this information available to the public is that it alerts healthcare organizations that a healthcare provider has been subject to disciplinary actions, which may be indicative of unsafe or poor quality care. It also potentially provides information if that individual lacks adequate skills or suffers from a substance abuse or mental health problem. Another pro of the information being available to the public is that it may indirectly affect frivolous lawsuits. Lastly, it may also increase physicians' motivation to provide care that is safe as well as quality. In my opinion, I do feel this information should be available to the public. This information allows for healthcare facilities to determine if the provider has the potential to provide care that is quality as well as safe, which is one of the most important things in healthcare. It allows them to see any past issues that have occurred and allows them to ask the provider about the situation and determine if it's still appropriate for them to join their healthcare team. Therefore, if they are or are not going to be a good fit within that community of healthcare providers, or if even patients would trust to have them as a healthcare provider, as now the internet is available all the time and we can always look things up. Though some information does seem to violate the rights of the provider, such as issues with substance abuse and mental illness, overall, the information should be available as it gives healthcare facilities the much needed information to determine, again, if the provider would or would not be able to be employed at the facility. Personally, I've had a few experiences with this when I lived in a rural community. They were going to hire a provider, and then they found out some information that was disclosed about his practice, and therefore they chose not to hire him because they determined he wouldn't be a good fit for the facility, just with some of the things that they found out through that. So overall, I think it allows us a better idea of not necessarily who somebody is, but how they practice. But at the same time, I do think we need to give the person the opportunity to explain if the situation is within reason. And then we can determine from there, have they changed? Has their practice improved? How long ago was it? What was the situation? So there's a lot of things that must be considered in this in order to make a decision. So thanks for listening, everybody. Bye.